Well, as the fight against COVID-19, the chairman of the Grand Bahama Health Services COVID-19 Task Force gives us a better idea of that island's epidemiological status. For the details, we turn to Megan Shepherd.
The island of Grand Bahama stands at 8 confirmed cases, the latest added to the numbers on April 30th. This case coming after weeks of no reported cases on the island. Now, chairman of the Grand Bahama Health Services COVID-19 Task Force, Dr. Frank Bartlett, explained that new cases can pop up seemingly unexpected due to a lot of persons being positive but asymptomatic.
One of our recent studies now revealed that as many as 44% of the persons may have no symptoms whatsoever. Now, when we're looking at reopening and how we structure that, first you have to have an understanding of what epidemiological category you fall into. You can either have a situation where you have no disease, you can have sporadic cases, where it means you have cases every now and then. You can have several cases popping at the same time, or clusters, or you have incidents where you may have what they call a sustained community transfer. So what you're trying to achieve, in order for you to even consider, you have to be able to identify which epidemiological classification you're in. For all intents and purposes, Grand Bahama falls in the category of sporadic cases. So sporadic cases have a better chance of having better outcomes if they were to reopen than persons who have sustained transmission.
He further explains that when looking at the 3 scenarios that can possibly come out of the epidemiological classifications, it can be that you may have broken the chains with the measures put in place, which means you have no disease. He also adds this scenario.
The other issue, and which is a more plausible one, is that you have waves where you have a period where you don't have any infection and then it actually reoccurs again. Okay, and the other one is where you have continuous low-level transmission, meaning that you have persons in the population that still have the disease who are asymptomatic and can still transmit the disease to somebody else. So in order to think about that, you have to be able to identify and have an idea of what you're dealing with. Now, when you're looking at, again, reopening, before you even attempt to do that, you have to be able to look at what capacities you have, so it means you have to do an assessment. First thing is, if you do open up and you do have a resurgence, you need to have in place the medical or healthcare capacity, to mean they have the ability to respond to any type of resurgence. So it means you have to look at all resources, human resources, look at your facilities.
He adds that when reopening is considered, it must be a phased approach. He shares this method that is currently being used in other countries.
One of the things that some countries are doing that we've had discussion with, at least at the task force level, is the system or process called reverse quarantine. So in this scenario, what you do is you quarantine the persons who are more vulnerable. So if you're doing it in a phased approach, we may identify and say the elderly persons or the persons who have poorly controlled hypertension or diabetes. We're going to make sure you stay quarantined in the first phase to prevent them from interacting and potentially catching disease, adding to the burden and everything else. You have to do an evaluation in the workplace. We've already started that in Grand Bahama.
Now, Bartlett emphasizes that persons must still not let their guards down, but rather continue to adhere to the policies put in place, which include social distancing and wearing of masks.